Okay, so for our mock patient therapy session today, we're going to work on the functional goal of lack of hip abductor strength as well as rotation strength, so external rotation strength. We have a patient here who has a right hip labrum tear. So we'll get started. So Hannah, as my patient today, we're going to work on some of your rotator strengths. So what I'm going to have you do is lie down on your left side here, and we'll have your right side, which is going to be the affected side up. So this activity is going to be a clamshell. So what I want you to picture is just an opening closing of a clam, like the mouth.
Mm-hmm.
So keeping your feet together,
Mm-hmm.
I want you just to move your knee up towards the sky and back down slowly.
Okay.
Now, the main thing to remember for this is that I want you to stay within your pain-free range. So if you reach a point where you start to really not like it, don't knock on that door. Just kind of come back down and just go back down to where you can.
Okay.
So if you want to give that a shot.
Yeah.
So some things to look for form is you want to look to make sure that the ankles are together, that they're moving just from the knees, that the legs are going to be at a 90-degree knee angle with the hips at a 45-degree angle, and that the hips maintain a stacked position on top of each other. Great. Nice. Okay, so that slow descent is that what we're looking for.
Okay.
And I want you to do that 10 times.
Okay.
Okay. All right. So yeah, nice. Good form keeping the feet together, just moving with your knee. That's going to be working the external rotators in your hips, which will later help out with the pain that you're having with the squat as well as the instability feeling.
Okay. I think I have 2 more.
Okay. 9 and 10. Awesome. Sweet. So we're going to do that for 3 sets.
Okay.
We'll have you do this at home as well, give you that exercise program.
Okay.
But for at home, we're going to go into the progression,
Okay.
which to progress this exercise,
Mm-hmm.
we're going to give a little bit of resistance in
Okay.
between your legs.
Okay.
So we'll give this band here,
Okay.
which typically would have something a little bit more, a little lighter to start with, but we're working with what we have today. And we'll do the same thing.
Mm-hmm.
The key again is to work within your pain-free range.
Okay.
So I want you to keep your feet together,
Mm-hmm.
move up with your knees, but if you start to feel any pain coming from your hip area,
Mm-hmm.
don't push too far, just back off to where it is good,
Okay.
and then come back down.
Okay.
Okay. All right, so we'll do 10 of these.
Okay.
Nice. Great. Great. And remember that you're slowing your descent coming down. That'll be the bulk of the strength right there. How's that feeling?
It hurts, but it's okay. It's definitely working.
All right. So remember, you're not trying to reproduce any of that
Yeah.
pain that you're having.
It's more like a muscle burning. Like it doesn't
Okay.
hurt the same pain, but
There you go.
Yeah.
That's good.
that was 10.
Okay. All right. All right. So next we're going to work with hip abduction. So we have you set up with the TheraBand around your ankle. And what I want you to do is you can stabilize yourself on your support to your right, but keeping your feet forward. Just bring your right foot out and back in. And remember that you're going just in your pain-free zone, so you don't want to be reaching a point where you start to feel that hip pain. You just want to be working in that good zone. And when you're coming back in, you're having a nice controlled descent down to the down to the start.
Okay.
All right, so you do 10 of those. Some things to watch out for form-wise for the therapist is you want to make sure that the toe is going to be facing forward, as well as she has a nice stable background, so she's not relying too much on her upper body to try to compensate or try to catch herself. You can also watch for, it's good to have slightly bent knees so you can have a nice stable base. And once you've done 10,
Last one.
nice. All right, so that's going to be the exercise that we'll start with.
Okay.
When you're ready, we'll do 3 of those,
Mhm.
and then also at home as well.
Okay.
But when we're ready to progress, we'll move on to some banded walks, lateral walks.
Okay.
So what we'll do is we'll put this band around your legs
Okay.
and above your knees. what I want you to do is you're going to go into a slight, almost like a mini squat,
Okay.
where you're slightly bending your knees and your hips. You're keeping a tension between your knees through the band,
Okay.
and you're just sidestepping across.
Okay.
And now when you do the sidestep, it's okay to let some of that band's tension release,
Okay.
but you want to keep that band above your knees.
Okay.
Some things to watch out for form is you want to make sure that the toes are always going to be facing forward. You want to watch for her trunk. Make sure that is always with the chest up, nice flat back, and good stable control. Other things is you want to try to make sure that the knees are staying in a forward direction as well, and that they're not collapsing inwards. If you wanted to progress this even further, is I would ask the patient, so now that while you're doing that, I want you to do the same thing. Just try to keep the same amount of tension through the band as you're walking.
Okay.
Nice. All right, so this is going to be working the same muscle as before with your hip abduction, but also working some of the rotators in your hip as well. So things that are going to help control and help stabilize your hip, so that you have, so we can progress.
Okay.
Nice job.
Thank you.
All right, so we're going to start with the neuromuscular retraining. So for the examination, we started with the Trendelenburg test, which she scored a 20 seconds on, and that is 20 seconds before her hip dropped during a single leg stance. So we're going to turn that examination into an intervention. So for the patient, actually before that, we would have normally a mirror right here so that the patient can get a feedback, a visual feedback, so she can watch her own hips. But because we don't have that, I'll be giving cues to the patient to try to help out by maintaining a level hip pattern. Okay, so Hannah, we have you set up. We have you near something that you can hold on to if you need to.
Okay.
But what I want you to do is having both hands on the hips, stand up on your right leg, trying to keep your hip nice and level. So you're going to be holding this for 15 seconds. I'll have you timed.
Okay.
And then we'll do that a few more times just to build up some strength.
Okay.
Again, normally there would be a mirror here, but I'll give you some cues.
Okay.
Okay?
Yep.
All right. And go. Nice. All right, so you're dropping your hip a little bit. Remember to keep it upright. Nice. You're going a little bit high. Try to drop it down just a little bit.
Okay.
Nice. You have a few more seconds and bring it back up. All right, and stop. Okay, so we want to try to do as much as we can, those 15 seconds within that level hip. So now that you got a good feel of it, we'll do that again, and we'll try to reduce the amount of hip drops and hip hikes that we get each time.
Okay.
All right. Cool. So now that after that, when the patient is ready to progress, we move on to something such as a lateral step down, which we do on this stair here. Again, we would have a mirror for the patient to watch her own hips so that she can visually see as she's lowering herself down that she can keep her hip level to the ground. Okay, so Hannah, again, we've got the railing here. You can use it if you need it,
Okay.
but if you can, try to keep your hands on your hips.
Okay.
So what I want you to do is, starting from an upright position, on the step,
Okay.
you're going to step down, trying to keep your hip level to the ground as you lower yourself down to the bottom step.
Okay.
Very good. So your hip is dropping just a little bit, so
Okay.
try to just lower yourself down. Awesome. Nice. All right. So you'll do that 10 times,
Okay.
and then we'll do a few more sets of that.
Okay.
Some things to watch for the therapist is, again, you want to keep the toes facing you. The patient can be looking at the mirror. You want to watch for the knee to make sure that the knee isn't coming too far medially or twisting or rotating. And you want to make sure that the patient is with a good upright trunk control, with the chest up and the back straight. But, all right.
2 more.
1, 2. Awesome. Okay, so next we're going to work on some stair climbs. Again, this will be working with some of the hip musculature, like the abductors and the external rotators, but as well as working on some of the neuromuscular education. So Hannah, so what we're going to do, or what you're going to do, is you're going to be standing on the third step, and you're going to be coming down down to the bottom step. Now, what I want you to do is keep both of your hands on your hips and going down to the next step with a very slow descent, trying to keep your hips as level as possible. It's okay that your knee is bending a little bit more. So normally, at our clinic, we would have a mirror right here to help out with some visual feedback. But because we don't have that, the therapist will give some feedback. So Hannah, you can go back up to that step, and we'll keep doing that for 5 times.
Okay.
So as the patient is coming down, I'm looking for things such as knees going more into the midline, as well as some of the trunk control. So nice. So Hannah, remember that you want to try to keep your knees over your toes as you're stepping down.
Okay.
We have great hip control. Nice. That was great. Nice. So you had your knee over your toes, and you had the hip nice and level. So you can go on up. We'll do one more of those.
Okay.
And also looking for things such as good trunk control, chest up, not slouching too much, and that's awesome. Nice. Knees over toes. That's awesome. Awesome. All right. Great one to finish on. All right. So for our progression, we'll be adding some weights to both hands and doing the exact same thing. This will be increasing the load that your hip is going to be feeling as you're moving down the stairs.
Okay.
So even though we're doing these nice and controlled and slow as we're going down, and it feels like, oh, I would never climb the stairs or descend the stairs at home like this, this will help your muscles know what it feels like to keep your hips nice and level and everything in the right alignment, so that it happens much more smoothly and without you even thinking about it later on. Okay. Nice. So again, you do that 5 times, and we'll do 3 sets of that.
Okay.
And I think you're good.